The public health community and others have become alarmed by the spread of H5N1 avian influenza to farm animals and agricultural workers in the United States. But the initial response to H5N1 seems to have been affected by some of the same problems that hindered our COVID-19 response. And new political and legal challenges are looming. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Gregg Gonsalves, an associate professor of epidemiology at the Yale School of Public Health. Dr. Gonsalves has co-authored a perspective article about the H5N1 response and lessons from COVID-19. Dr. Gonsalves, what's currently known about the spread of H5N1 avian influenza in the United States?
Well, I think the big challenge is what we don't know. We know that it's been found in several cattle herds. It's been shown in poultry and some other animal species. It's been shown to have infected agricultural workers, poultry workers. What we don't know is the extent of the infection among livestock and among workers who work with these animals, because our testing infrastructure, our testing efforts have been underwhelming, to say the least.
So in that regard, what has the response to the threat looked like at both the federal and the local level?
It's been piecemeal and fragmented. Remember, we have a situation here where we have different kinds of federal bureaucracies battling with each other for control over the response between the USDA and Department of Agriculture, the CDC, and the other agencies within the Public Health Service. And so the jurisdiction about who's in charge here is not very clear. In the context of the COVID pandemic, we had these sort of jurisdictional battles playing out. And the whole idea was that let's invest the CDC with greater authority to lead the pandemic, to have better interagency support. But we still have ambiguities about who's in charge here. And we have turf battles between the federal government and the states about who gets to go onto these dairy farms, who gets to go into these poultry plants, etc.
And given those turf wars, what do you see as the gaps and the limitations in the response?
Our op-ed, our commentary, our perspective in the New England Journal is just one of several voices being raised about worries about the response to H5N1. We don't know what's going to happen in terms of the evolution of this outbreak and whether it has a real potential to jump into humans. Now, we haven't seen human-to-human spread, but we need better epidemiology, right? We need to have a better handle on what is the extent of exposure to this virus, both among animals in the agricultural setting and nearby wildlife, to know what its penetration is into the working population on farms across the country. That's the first step in understanding what to do. We also need to be able to make a plan that can be actionable in terms of what we need to do should this become a more widespread outbreak and epidemic. And it's not clear that we have the resources or the tools to do that. We came out of the COVID pandemic arguably weaker than we did going into it in terms of the state of our healthcare workforce, the legal and policy restrictions that have been newly imposed upon public health responses. And so whether we're up to the task of a new pandemic, even as we're in the midst of the COVID pandemic, is up for grabs.
In fact, in what ways has the social, political, and fiscal environment changed from early 2020? What are the differences?
A couple of things. One is that we've had a huge backlash against public health. There have been legal cases across the country that have sort of restricted the ability to impose public health restrictions, even if they aren't evidence-based, in terms of keeping public health departments from closing schools. We've had attacks on mask mandates. We even had larger questions rising in the legal context, like the dismantling of the Chevron defense in the Supreme Court over the past few weeks, which really puts the administrative state into disarray. And it's going to be very hard to know about who's in charge again when we have a national crisis. It's going to impair health agencies' ability to respond to new health threats. We also have a situation where we're not quite sure we can adequately respond to the threat in front of us rather than the threat behind us. Any new pandemic is not necessarily going to look like the one we've just come through. We need optimal flexibility, and some of these legal restrictions have tied our hands in advance about what we're allowed to do. As I mentioned, the public health workforce is still not what it needs to be. One of the troubling decisions that has been made is that in 2024, for the fiscal appropriations bill, money is being returned to the federal coffers because it's been unspent. So these rescissions in the budget for local public health agencies really ties their hands at a point when they're struggling with the end of the public health emergency and the COVID-specific funds that were allocated to strengthen our public health response. We also would like to be able to be ready to do an Operation Warp Speed for whatever new pathogen might emerge, whether it's H5N1 or another. But we did not have a great experience for all manufacturers, Johnson & Johnson, AstraZeneca, Novavax. They had trouble gaining market share. So are they going to continue to come forward to embark upon a new R&D exercise? Should we need to develop a new vaccine for pathogen quickly? It's really unsure right now. And we don't know whether Congress really has the appetite, at least the current Congress, for anything more on pandemic preparedness whatsoever. And so we're in a situation where people would like to forget about what happened with COVID, have reacted extremely negatively in terms of the ability for public health to function properly in the context of what we do through the legal system, through Congress, through state legislatures, through governors. And we may be in a situation where we're less prepared than we were 4 or 5 years ago to deal with a new pandemic.
So if those circumstances don't change, what options would public health officials have for responding to a potential pandemic?
The problem is that with your hands tied, struggling for funding, we are in a situation where we're going to have to think about a pandemic being worse than it would be had we sort of responded to the COVID pandemic in the right way. Remember, we were not a leader among the G7 nations in terms of our response to the pandemic. All the things I discussed, this the antipathy to public health measures, the legal restrictions that public health departments face, the squabbling between agencies, the lack of our robust safety net and our fragmented healthcare system all put us in jeopardy before the pandemic, and it showed in our response to COVID-19. We did much more terribly than our G7 peers. We're in a situation where we're going backwards. We're not going forward. We're refusing to learn the lessons of the COVID pandemic. And so we can have a new pathogen that could be less deadly than SARS-CoV-2, but because we have sort of declared mission accomplished with COVID-19, we may be in a situation where this new pathogen spreads more quickly, even if it's lesser pathogenic, and can lead to more deaths just by the sheer number of people it infects.
Finally, what role can healthcare professionals play in ensuring that evidence-based approaches to protecting the public health can be the focus going forward?
So physicians and nurses and other healthcare professionals know the price we paid for our response and our poor response to COVID-19. They saw many of their colleagues die on the front lines of the pandemic in 2020. Many of them had dozens and dozens of patients die in emergency rooms and ICUs across the country. They know the public toll that this current pandemic took on America and took on the healthcare profession. We can't go there again. We can't go backwards. And the healthcare workers therefore have an incredibly important role to play in educating the public that there are ways for us to deal with a new pandemic. Should it come for us, whether it's H5N1 or another pathogen. And it means really listening to what the science says, investing in public health, both in a financial sense in boosting our public health workforce, but also using science to guide our responses. And the inability of politicians and pundits to really understand what's at stake here is something healthcare workers and physicians and nurses can work to push against.
Thank you, Dr. Gonsalves.